Good evening, everyone. I would like to welcome each and every one of you for Mental Health Webinar Series 2020-2024. Today we are on session 1691 on topic 93 on topic irresponsible doctors with our honorable resource person Dr. Venugopal Reddiar. Sir, I would like to welcome you, sir. Then I would like to welcome other organizers, participants, and coordinating team members on behalf of the American College Madurai in association with Elopan Counseling Center, Chennai, Tech and Positive Mental Health Practitioner Association, Andhra Pradesh. Now, short intro about today's resource person, Venugopal, sir. Sir has been a physician and behavioral scientist from USA. With that short intro, I would like to hand the session to you, sir. Happy to have you, sir. The floor is yours.
Thank you, Navinji. I'm thankful to the Psychology Department of American College, the organizers and coordinators this mental health webinar, for giving me the opportunity to share my knowledge to enlighten and empower the audience so that they could enjoy a healthy life. Let me start the PowerPoint presentation right away. My dear friends, I will be sharing the PowerPoint slides after my presentation. So you don't have to keep on reminding me or asking for the PowerPoint slides. Then during the presentation, my humble request is, please don't put any message in the chat box. If that will be a distraction for the speaker and as well as for the listener. And the questions also, you can ask the questions as soon as I am done with my presentation. Am I audible? I don't know why Dr. Pontiamani is not audible. So that is it. Any questions, please don't put the questions in the chat box now. After I complete my presentation, you can ask me the questions or you can present the, thank you. The topic is irresponsible doctors. This is a vast topic. I can talk on this topic for 6 hours, that is 360 minutes. But I'm going to limit my presentation to 35 minutes. That is 10% of what I know. Purpose of today's talk: make you aware of irresponsible doctors, persuade you to avoid irresponsible doctors in order to protect your life. First, you must be able to identify the irresponsible doctor. Once you identify, you must avoid them if you want to save your life. My webinar is based on TEQ: truth, experience, and quotations. Experience: I've been practicing medicine for more than 50 years, half a century. Jyoti ji and others, please don't put any message in the chat box. It is a distraction for the speaker. Thank you. This is irresponsible behavior of the participants. We are talking about irresponsible doctors. What about the irresponsible listeners? And my experience, it has been going on I don't know how to make these people get the message. I've been practicing medicine for more than 50 years. So I'll be sharing some real life experience, stories from my real life experience. A lie is still a lie, even if everyone believes it. Truth is still truth, even if nobody believes it. Doctors who are allergic to bitter truths won't like me for telling the truth publicly. I am fully aware of this fact. But I believe in my philosophy is to speak truth. Don't be afraid of speaking truth. Definition of the term irresponsible. Lack of concern for the consequences or impact of one's actions. I'll read it again. Lack of concern for the consequences or impact of one's actions. There are a few books on dangerous doctors. Deadly doctors. Don't let your doctor kill you. There's an old proverb. The doctor is often more to be feared than the disease. I'm going to share you some facts that will be shocking for some of you. These are authentic facts. You can verify the veracity if you have some doubts. An estimated total of 10,000 Americans die or suffer potentially fatal reactions following the administration of antibiotics that are not needed. According to studies at the University of Florida and Ohio State University Medical Schools, 10,000 Americans. We don't have any data from India. And antibiotics are misused. And my dear friends, for your information, take the case of cough. If 100 patients are coming with the symptom of cough, 80% of them, they don't require any antibiotic. The cough is most often due to a viral infection, viral bronchitis. Antibiotics don't work. But the patient will suffer from the adverse effects, side effects, as well as other effects of the antibiotic. And especially in India, I know very well, antibiotics are misused widely. The doctors, they prescribe antibiotics as if they are giving some candy. Sore throat, a common problem. 95% of the patients, they don't require any antibiotic. Viral pharyngitis, all that is required is warm saline gargle 3 or 4 times a day and avoid cold food or drink till the symptom is completely gone. And if the pain is more, just to take a paracetamol painkiller and use the throat lozenges. Simple. That is what I always do if I do get any sore throat, as well as I prescribe, tell the patients that is what they should do. No antibiotics most of the time, 95%. American surgeons, a Cornell University study indicates, are performing an estimated total of nearly 2.4 million unnecessary operations each year, in which 11,900 patients die as the result of complications. Again, data from America, because we don't have any data. We don't have any data about what is happening in India. That is a population in America, 33 crores. In India, 140. And you can use your own, the common sense to understand the magnitude of the problem. So many operations are performed unnecessarily. Cesarean section. In the past, more than 80% of the deliveries, normal, natural delivery, but in the private hospital these days, more than 80% of the deliveries are cesarean, so that the doctor can go and sleep comfortably in the night. And the deliveries take place during the daytime. Unnecessary operations, I'm going to give you some more information later. Medical error is third leading cause of death in US Third leading cause. First cause is heart attack. Second one is cancer. Third one is medical error. And obviously, in India, self-medication is very easy. In USA, you cannot get an antibiotic without a prescription. Whereas in India, patients, they go to the medical store. They ask for, amoxicillin. Azithromycin. No problem. Or painkiller. No prescription. So I know plenty of people taking medication, self-medication, and some people develop kidney failure. Kidney failure is so common now. That is because of self-medication. The doctors also, multiple doctors. Then what happens? I'm going to share that information soon. Irresponsible doctors. Okay, now we need to know. Irresponsible doctor, that is a symptom. Headache is a symptom. We must find the cause. Why this person is having headache? If you treat the symptom, you will be giving just a painkiller. You are not dealing with the root cause. The headache could be due to fever. Headache could be due to sinusitis. Headache could be due to hypoglycemia. That is, if a person skips a meal or skips a breakfast, they may get headache. Or headache could be due to dehydration. But what happens? Do the doctors have the time to get a good history? The doctors, busy doctors, they spend hardly 5 minutes or maximum 10 minutes with a patient. They don't go into the details. They will immediately give a painkiller. And they will order unnecessary investigations. So, root cause. So here, why the doctors are irresponsible? That's what I'm going to share. Irresponsible doctors lack passion and compassion. Parental pressure, wealthy life partner, high income, prestige, etc. are the real motives for choosing the medical profession. Those are ugly facts and truths. My dear friends, I talked to nearly 25 doctors before preparing this presentation. 25 doctors from 5 different countries, from the USA, from Canada, from Australia, from Middle East, and from India. And some of those doctors are my teachers. Some of them, my own MBBS mates who worked as the professors and retired from the medical college service. I myself was a medical teacher. Before I left India, I was assistant professor of medicine in 1992. So I have taken all efforts to make sure what I am sharing is authentic. So the first one is parental pressure. Children who don't have any passion for medicine, the parents force them, compel them. And every year in Kota, in one place, that is in Rajasthan, children who go for taking the NEET, preparing for the NEET examination, nearly 20 to 30 children, they commit suicide in one place. So you can imagine, easily hundreds of children every year, they commit suicide because of the parental pressure. No passion. Then again, sending the children to become a doctor. Yeah, a rich girl. If my son becomes a doctor, Lala is from a wealthy family or a rich boy. So that is the motive. Not to take care of the sick. It is alliance, matrimonial market. Yeah, very good value. Then comes high income. Yeah, if you are a doctor, you can make a lot of money. You can have a rich, comfortable life. As a prestigious status. Yeah. My son is a doctor. My daughter is a doctor. Yeah. Prestige. These are the motives. And I'm going to share more information, authentic information that would validate that slide. Number of medical colleges in India rose to 730 from 387. Most of them are in the private sector. My dear friends, do you know how much it costs for completing the MBBS course in private colleges, medical colleges. Amrudananda Institute of Medical Sciences, that is in Kochi. You can check in their website the course fee, MBBS course fees for general category, 1.25 crores tuition fee. I'm not kidding. SRM Chennai, 1.13 crores. In other private medical colleges, 50 to 80 lakhs. And after complete the MBBS, you cannot practice and make money. If you go to any hospital with an MBBS qualification, the salary is 30 to 50,000 rupees. Then you have to go for MD or MS. It will cost another 1 crore or 2 crores. And if they take, most of them, they take loan from the banks. And the interest rate. And we have Maladi Arsuji. Interest rate. I checked. South Indian Bank. Car loan, 9%. Education loan, 13%. So they'll have to pay 2 to 3 lakhs. The interest. And an MD doctor, fresh junior MD doctor in Kerala, they get 60 to 80,000 rupees. So how can they pay the interest? They cannot. Then what happens? Okay, that is where they engage in unethical medical practice. Not all doctors. At least 50% of the doctors, medical students who go to these private medical colleges, they avail loan. And they are in debt trap when they complete their course. So they will order all these MRI, CT scan, ultrasound. And you may say that they are greedy. No, it's not greed. They have to. Tell me, my dear friends, think, how can they survive? Root cause, parental pressure. To make anybody think or act responsibly, his or her mindset must be changed first. First, the mindset of the parents, grandparents must be changed. And changing the mindset is extremely difficult. 5 traits of irresponsible doctors. Unethical. Greedy. Yes, some people, even if they get admission on the merit basis, even if they don't spend so many lakhs, even if they are not in debt trap, they are greedy. That greed button gets pushed. Incompetent. When these doctors, they don't have the passion for medicine, they don't update their knowledge. They don't upgrade their skills. They are incompetent. I know that one. In USA, it is mandatory for renewing the license once it is issued, it has to be renewed once in 2 years. For renewing the license, you have to provide evidence of so many hours of continuing medical education. In India, no. Negligent, yeah. Because they don't have passion. When there is no passion, there is no compassion. When there is no compassion, what is compassion? Difference between compassion and empathy. Empathy is, yeah, you can feel their suffering. Compassion is not just feeling. You want to do something to relieve that suffering. Action. And when they don't have any empathy, there won't be any compassion. So they will, if the nurses call them, yeah, I'll come. They take their own sweet time. Negligence. Some infections, they get worse. Patients die for lack of getting timely care. And impatient. Oh, yeah, because they don't like. So they are poor listeners. They won't let you tell what your symptoms are. Impatient. For your information, medical diagnosis depends on getting a good history. Correct diagnosis depends on getting a good history. For taking good history, doctor must be a good listener. That's not happening. Five acts of malpractice by irresponsible doctors. Unnecessary procedures. I told you, unnecessary operations. Cesarean section, angiogram, stenting, angioplasty, all procedures. Easily more than 80% of the procedures, I think they are unnecessarily done in India. Unnecessary investigation. Yeah. Unnecessary investigation. My dear friends, do you know that is more than 95% of the case with the headache, they don't require any investigation. No investigations. Only 5% may require a CT scan. Or less than 5%. But what do we see? They get CT scan or MRI scan so that the doctors get a significant kickback. Significant kickback. It is not safe. One CT scan is not a low dose CT scan. The radiation coming from the CT scan examination is 100 to 250 times more than what a person gets when he takes a chest X-ray. So it is not safe, CT scan. The radiation again can cause a lot of damages. So that is another fact. So unnecessary investigation, yeah. Irresponsible doctors. Unnecessary medications, antibiotics, and other expensive medicines. Unnecessary admissions. If a patient doesn't require admission, they admit. If a patient doesn't require admission in the ICU, they admit in the ICU. Why in the ICU? Yeah, it's 30,000 to 50,000 rupees per day, ICU. I'm not kidding. Ugly fact. And unnecessary consults. Yeah. If you go to a multi-specialty corporate hospital, the cardiologist, they will refer to chest symptom, cardiologist, and abdominal symptom, the gastroenterologist. Then some headache, neurologist. So many doctors will be involved so that they can make money. And each one orders a bunch of tests. That's happening. Six types of medication errors or harms. Wrong medicine. The diagnosis is wrong, the medicine will be wrong. Wrong medicine. Very often it is happening. Overdose. My dear friends, I have had the opportunity to see some of my friends whom I got acquainted through the webinars. They occasionally send me the prescription. They got from a cardiologist, from a gastroenterologist or a neurologist, asked me to give my second opinion. They look at that one, very same medication in different brand name. The cardiologist has prescribed one medicine. Gastroenterologist prescribed the same medicine, but they different brand name. Neurologist also same. The patient is a layperson. The cardiologist is not doing deliberately because he doesn't have the time. He doesn't go through the medication the patient was taking. Now, overdose. So they take 3 times the dose. Overdose, new health problems. They fall sick. They get hospitalized. This is the reality. I am not talking. It is not a fictional session. Overdose. Timing error. If the medicine is to be taken before food or after food, along with the food, busy doctors, they don't make the patient realize that this should be taken on empty stomach. As a result, they take it with the food. It won't work. It won't work. Polypharmacy. Polypharmacy and drug-to-drug interactions. Polypharmacy. If a person is taking more than 5 medicines in a day, that is polypharmacy. And I find senior citizens, most of the senior citizens in India, they are taking multiple drugs. My dear friends, there is no need to take the vitamins except maybe vitamin D. But plenty of patients are on multivitamins, multiminerals, and antioxidants. And all these vitamins, again, they act against each other, interact. They act against some medicines, for example, Parkinson's disease. Parkinsonism. If they are taking vitamin B6 in some form, excess, that will decrease the effect of that medication. So what's the point in taking the medication? And multivitamin, it's happening. Polypharmacy. Then self-medication, going to the medical store and getting some antibiotic, some painkiller. And some painkillers, some of the painkillers, they are not safe. Patients develop kidney failure or patients develop bleeding from the stomach. Prescription. This is from Orissa, a doctor, prescription. You cannot make out what it is. It is, I think, like a chicken scrawl. The prescription is not readable. And obviously, the medical store guy, he will give some wrong medicine. Wrong medicine, all the consequences. Doctors' handwriting kills 7,000 people each year. This is the data from USA, and we don't know. We don't have any data from India. Irresponsible doctor. I always used to write in the capital, this one, alphabet, not a running script. When I was a teacher, I used to insist that my house surgeons write the prescription, make it legible, and in caps. On real life incident, I will tell you, long time back, 40 years back, when I was a medical student, one young girl was brought to the casualty, unconscious. She was found unconscious in the morning. She went to bed, morning she didn't wake up, brought, no idea what's happening. They did all the tests, routine tests, everything all right. Then when they found that the blood sugar was low, they were wondering why the blood sugar was low. Blood sugar was some 40 milligrams. Then the further inquiry, one doctor gave a prescription for an antacid, Diavol, and it was so illegible, she got a tablet for diabetes, Dionil. So she took that tablet, and the blood sugar went down. She got unconscious. And my dear friends, untreated hypoglycemia, if it lasts for more than 6 hours, it can cause irreversible brain damage. That happened to that girl. Who is responsible? Doctor. Illegible prescription. Handwriting. Unnecessary stents. Oh, it's rampant. Because when I put a stent, yeah, 2 lakhs. Then again, I'll say, do you want a local made or foreign imported stent? For imported stent, it will cost you 50,000 rupees more. You didn't know what kind of stent he is putting. And you'll say, that, yeah, foreign stent. First of all, most of the patients, they don't require any stenting. Unnecessary procedure. Don't go to if you have a chest pain, more than 90% of the day, chest pain has nothing to do with the heart. Chest pain could be from the chest wall, from the muscles, from the ribs, or from the acid reflux. But if you go to a cardiologist, they will immediately do a ECG, then they will do the echocardiogram, then they will do the angiogram, and if you are above the age of 50, yes, there will be some kind of a blockage. But they will immediately inject fear. Oh, block on the plaque, so you need to get an angioplasty stenting. You get worried. And you say, yes. If you have got a chest pain, my dear friends, go to a general medicine doctor who is not working in a big corporate hospital. They won't do all these things. Don't rush to a cardiologist. If you rush to a cardiologist, stenting is 90% of the time you are going to get a stenting or angioplasty. Doctors are just the same as lawyers. The only difference is that lawyers merely rob you, whereas doctors rob you and kill you too. Anton Chekhov, was a medical doctor. Medical doctor. So once the life is gone, it's gone. If somebody robs you, yeah, you can again make money. You are alive. The doctors, they are dealing with the life and death situation. So take it seriously. I am dying from the treatment of too many physicians. Alexander the Great, he died when he was hardly 33 years old. What's happening these days? From 40 years back, many patients I know, they used to consult only one doctor. Now they consult 3 or 4 doctors. They right away they go to a cardiologist. They right away go to a neurologist, a gastroenterologist. At a given time, they will have 3 or 4 doctors. They prescribe the same medication, overdose, drug-to-drug interaction. Eventually, just like what Alexander the Great said, I'm dying from the treatment of so many doctors. Because he was the emperor. So you are surrounded by so many doctors. My advice, take-home message is, don't go to a specialist on your own. Go to a general medicine doctor or a general surgery doctor. Let them decide. If they think that is okay, you require a special one, they will refer you. Let them refer you to a cardiologist. Let them refer to a specialist. Don't go there. This is one way you can save yourself. One way. Then identify doctors. Look at the kind of cars they are driving. How many cars do they have? Yeah, luxury cars, BMW, Audi, Mercedes. So many cars, living in a palace like a building. Be careful. Be careful, don't go there. Because you are going to finance for their lifestyle. Identify them. Then find out from where did they go for their medical study, MBBS. Private medical college, Amrudanandamai, SRM, yeah, I can be sure. Most of them may be in debt trap. One-man show, clinic, go there. And look at that, how much time the doctor is going to spend with you. If the doctor is not going to spend 15 minutes with you, stop going to that doctor. There are busy doctors in Trivandrum. I have the data also. One neonatologist, his consultation, every 5 minutes, patient appointment. In 6 hours, he sees more than 70 patients. 5 minutes. Consultation fee, 700 rupees per consultation. Yeah, busy doctor, people will go. Oh, he's busy, that means he must be very good. No, you are screwing yourself. You are getting screwed. Once again, to recap, irresponsible means lack of concern for the consequences or impact of one's actions. Irresponsible people in this society, I have talked about irresponsible doctors. What about the irresponsible people in this society? Parents. I find you frequently talks about parenting, effective parenting, talks. The parents are irresponsible. They give junk food. Plenty of children are suffering from obesity, other health problems because of the parents give the junk food. Parents give them mobile phone to play, 2-year-old kid. They get addicted to. Then they have problems, attention deficit, irresponsible parents. Irresponsible children, in the old age, their elderly parents, they don't want to take care of their parents, put them in some nursing home, elderly home, and even abandon. That's happening. Doctors, we discussed, patients, or more than 80% of the patients, they don't follow the medical advice. When you ask them to lose weight, do exercise, avoid this food, they don't. Take the medication 3 times, they take it only once. Or they don't even complete the course. 7 days, they take it for 3 days. Irresponsible politicians, we know. corruption, corrupt politicians. They don't care about the growth and development of the country. Looting. All the freebies, when they give the freebies, free bus ride, free this one for women, 2,000 rupees. Where does the money come from? Honest taxpayers' money. Then you won't have the money for the development projects. We shouldn't just simply blame the politicians. What about the voters? Yeah, voters, give me the money, I will vote for you. They don't even exercise the right to vote, that right to vote. And the 30% of the people, they don't even go for voting at all. That is irresponsible. The citizens' irresponsibility. Because of that one, bad guys, they come to power. These guys stay at home on election day and they criticize. Yeah, why? Why these guys are coming? Yeah, why didn't you go for voting? You are responsible. Judges, yeah, cases postponing, Supreme Court, lakhs of cases are backlog. And they take 2 months of vacation. Teachers, more than 80% of the teachers, they have no passion for teaching. I know, because I was a medical teacher in the medical college, I know my colleagues. And I am a guest faculty of more than 10 B.Ed colleges in India. Guest faculty more than 10 B.Ed colleges. So I have first-hand knowledge and experience. They come there because for the lifestyle. Yeah, and especially, yeah, the children go to school, they also go to school. When they come back, they also come back. And vacation, 3 months of vacation. No passion for teaching. They don't update their knowledge. Engineers, bureaucrats. Upcoming talk, every Thursday, I give a talk on my platform. Next talk, think like Trump. That'll be very interesting. Ignorance quotient. That is the Zoom link, that one. I'll be sharing the PowerPoint slides, then you can subsequently, if you are interested, you can join. That's one WhatsApp number. If you want me to include in my WhatsApp group, send me a message. No one is dumb who is curious. The people who don't ask questions remain clueless throughout their lives. Thank you for listening to me. Any questions or comments?
Thank you, sir. Jyoti Banka.
Thank you, sir, for the wonderful, insightful session. Sir, I want to ask one question, but it's my humble request that please do not get angry if the question appears a bit bitter. Because whatever you told, that is a harsh reality of the society, and we cannot change it. My question is that your talk, it is the truth. I agree it because I have visualized all this. And I have faced very bitter all of this. I have seen all this. So my question is that your talk was problem focused. What is the solution, remedy to all this? We cannot change it. We cannot change others. We can only take our responsibility. We can monitor our thoughts, words, actions. We cannot change the society because that is like banging your head against the wall or beating around the bush.
Okay, Jyoti ji.
So what is the solution to all this?
Jyoti ji, I think that you missed the points. I clearly said that. Parents, here also there are parents and grandparents. Please don't push your children to pursue the medical profession if they don't have passion. Those who are listening, at least to prevent. Take my case. I walk the talk. I'm a medical doctor. In USA, a medical doctor earns the pay, income is pretty good. IT sector job or management job, they make only 1/3 of what a doctor makes. My son, when I recognize he doesn't have passion for medicine, I could have forced him to pursue medical profession. I could have sent him to NRI quota, I could have got him admission in SRM or any other place I can afford to. I didn't. What did I do? I just assessed. Parents should assess. Don't take your child to some counseling. Counselors, they don't know your children. I saw that he He's good at communication. He loves interacting with the people. And he used to watch all these slogans, advertisements. I thought, okay. I motivated him to pursue a career in marketing. And I sent him to India. From the 8th grade, he studied in India and he stayed with his parents. Why did I send him to India? I didn't want him to lose that roots, culture. And he stayed with his grandparents. I was in USA. I didn't even send him for any tuition culture. I taught him how to use the internet for his studies. And he passed the 10th grade with a distinction. Then I sent him to Christ University, Bangalore for BA Economics. Then he got admission for MBA at Pune Symbiosis. I told him, I'm not going to get you a seat on the basis of NRI quota. The cutoff score is 96%. He studied well and he got 97.8% and he got into, subsequently completed MBA and he worked in India for 7 years. Is this money? No. What he was making, not at all. Anywhere near a doctor could make. As a parent, I have shown the responsible driven. That is the message, Jyoti ji. Parents should act responsibly. Then,
Sir, my parents,
Jyoti ji, please, let me complete. Secondly, I told you, don't go to a specialist. Go to a general medicine doctor. Go to a general surgeon. And don't do any self-medication. If you have fever, even now, 95% of the patients suffering from fever, if you take rest and drink plenty of water, warm water, and kanji, rice kanji and all those things, fever will go away. But because of the fear and anxiety, oh, is it dengue fever? Is it chikungunya? Is it COVID? Or is it monkey fever, pinky fever? You go to a hospital, then they will order all the tests. Lab tests will cost nearly 2,000 to 5,000 rupees. When the tests are negative, one whole day is gone. Then if the doctor says, yeah, everything is normal, I'll go and take rest, will the patient be happy? No. So that doctor prescribes an antibiotic. So take home message, fever, wait for a couple of days. The fever, new symptoms along with fever, then go and see a general medicine doctor. 95%, you don't need to. You don't have to. Oh, what can you do? What can you do? What can you do? You cannot change others. I told you. Mindset of others, you cannot change. We have to change our own mindset. Our own mindset of unnecessarily getting worried, fear, rushing, social media, and fake messages. Too much of fear. And stop eating junk food. Your immunity. Jyoti ji, many people, their immunity is so low, they eat junk food. My immunity is very strong. I didn't take even a single dose of COVID vaccine. Not even a single dose. I didn't wear any N95 mask. And I'm in USA, the maximum number of deaths, 10 lakhs, more than 10 lakhs in USA. Was I worried? Was I afraid? No. So, take my message, stop eating junk food. Eat healthy food. Children also healthy food. Don't immediately go to a doctor. So that is what you can do. I cannot change all the parents who want their children to become doctor. I cannot. At least in this group, now nearly 90 participants, if 10 participants, they get this message. And if they don't push their children, that is all what is required. Okay, anybody else wants, I don't want to engage in a debate. Anybody else who wants to ask a question? Please raise your hand, I will call you. I will call you. I don't want to trouble the organizers. If you raise your hand, I can see, I'll call you. Anybody else? There are no more questions. Thank you for listening to me. I'll be sharing the PowerPoint presentation soon after the session, and you'll be able to get that PowerPoint slides if Dr. Salim shares it with you. And we'll be sharing the video recording also today itself. So watch this video at least a couple of times. A lot of material I have shared, couple of times, and you'll be enlightened, you'll be empowered, and you'll be able to save a lot of your time, money, energy, and your health also. That's the most important thing. I wish you all the best. Thank you for joining this session.
Thank you, sir. Thank you.
Thank
Accept
you
the
so much,
gratitude.
sir.
Thank you very
Thank
much.
you.